I recognize myself as chair for 5 minutes now. Mr. Parker, I'd like to focus on the COVID standards. During the Obama administration, OSHA started work on an infectious disease standard that would have covered healthcare employers. But the Trump administration killed that, and it chose not to develop an emergency temporary standard on COVID-19. Did these choices put OSHA on the back foot when President Biden ordered the agency to protect workers? Ms. Parker.
Thank you. I do believe that if more work had been done to complete an infectious disease standard, that OSHA would have been in a better position to address COVID within the scope of that rule. In California, there is an infectious disease standard. I was the chief of Cal OSHA prior to taking this position. And so from my experience, I know that the state was in a much better position to address infectious disease in hospitals, which was the scope of that rule. There were standards in place, there were plans in place that hospitals were required to have. Our staff were trained on it, there was a mechanism, and there were clear expectations of hospitals. It certainly wasn't perfect, and hospitals certainly were not prepared for the scale of the pandemic that we all experienced. But it certainly put Cal OSHA in a better position to be able to enforce basic infectious disease controls because of the existence of a standard.
Okay. Well, let me turn to some more current matters. OSHA published the healthcare ETS last June. The OSHA Act requires OSHA to develop a final standard within 6 months, but OSHA failed to meet that deadline. OSHA was given $100 million in additional funding through the American Rescue Plan for COVID-related work. Did OSHA hire any new FTEs for its standards office so that it could work on more than one major standard at the same time?
We have been using ARP funding to hire staff and to hire contractors to work on COVID-19 standard making. We hired about a dozen FTE during that time period, and some of those have been working on the standard. It's a little bit difficult to bring people on a project that's happening on such an accelerated scale and rapidly incorporate them into the project planning process. Our teams had a plan that they were executing that made it a little bit difficult to grow, but I think that they've done it. I have to say our team's done an incredible job under the circumstances of moving forward.
Okay, let me move on. From where I sit and from where many of us sit, it's difficult to understand how OSHA could have this level of resources and not be able to produce two standards at the same time. What were the challenges that kept OSHA from being able to issue and enforce these standards in a timely manner? Can you give me a quick answer to that? What were those challenges?
Well, part of that, occurred before I was confirmed as assistant secretary, but I've done some review, and I think that there's simply certain bottlenecks in the process that make it challenging in order to make sure that a rule is meeting all of the required legal standards, to make sure that it's sufficiently supported by the evidence. It requires a great amount of work, and given the time that it takes to hire people, it frankly just would have been difficult to gear up quickly enough to move faster and sort of move the needle significantly with hiring in such a short period. We are now hiring, we're continuing to hire, and we've certainly made funding requests to expand our rulemaking team so that we're better prepared in the future. But it's simply challenging to invest those kinds of resources for such a quick turnaround as the one that our task required us to do.
All right, thank you, sir. I'm out of time. And so I'm going to move on and now and